All right, if you don't already know who I am Anna Dorley Anderson. I am the programs manager for the Center for Global Surgery. Dr. Sudhajaya Raman, our director, was hoping to be here to introduce our guest. Unfortunately, she is covering trauma call right now and is currently in the OR. That said, today's guest is Dr. Batsukh Pushkin. He is a distinguished Mongolian surgeon specializing in breast and thoracic surgery. And he's currently serving as the chief of the breast center at the National Cancer Center in Mongolia. He has over a decade of experience and his MD and MPH. He has completed fellowships in both thoracic and breast surgery, as well as additional advanced courses in breast cancer diagnoses and treatments. He is committed to comprehensive patient care, specifically in areas such as breast reconstruction surgery and women's endocrinology. So without further ado, I will pass it on to Dr. Pushkin.
Hello, everyone. And nice to meet you all, and appreciate for giving me this valuable opportunity. Today, I'm going to sharing with you and a multidisciplinary team care for breast cancer patients, the National Cancer Center experience. Yeah, firstly, it's a short background about Mongolia. Mongolia is a landlocked country in East Asia, bordered by Russia to the north and China to the south. It covers area almost 1.6 million square meter. It means 600 2,000 square miles, with a population just 3.3 million, and making it the world's most sparsely country. And also, Mongolia is the world's largest landlocked country, and it doesn't border closest sea, and much of its area is covered by grassy steppe and north and west, and the Gobi Desert to the south. Approximately 30% of the population is nomad or semi-nomad, and horse culture they still remains integral. And for the economical status of Mongolia, the developing and the low middle income country. And also, Ulaanbaatar, the capital and largest city, is the home to roughly half of the country's population. The Ulaanbaatar city is officially world coldest capital. The temperature is ranging between minus 15 and minus 40 degrees Celsius, and the average annual temperature is minus 1.3, and more over January and February, the coldest months. And National Cancer Center of Mongolia established in 1961, and about breast cancer. Breast cancer statistics in Mongolia. Breast cancer is the fourth most common cancer among women, and unfortunately, over 50% of all diagnosed breast cancer are diagnosed at advanced stage at the peak age is 42, 49. Due to the late stage diagnosis, the majority of women with breast cancer undergo mastectomy surgery, and the survival rate less than 50%. Yeah, and 2014, 2019, the virus status, and I mentioned that over the 50%, 57% of women with the breast cancer diagnosed advanced stage 3, and stage 4, and still stage 2 is just 35%. Due to the late diagnosis status, and a lot of women with breast cancer received mastectomy surgery over the 90%. And another thing is breast cancer incidence age peak is 45, 49 is really high. Also, the 40 to 44 is similar. Than it's premenopause woman diagnosed in our country, really common. And to 2021, and then Mongolia, almost 789,000 women aged 30 to 69 aged, and that time in the Mongolia reported almost 332,000 women attended the breast screening program. It's been a 41%, and at that time just detected screened 3 breast cancer. It's been reason is the last 10 years in Mongolia the breast cancer based on just clinical breast exam. In order to increase the above situations, we need financial and professional advice, and we are focusing on the following 3 points currently. And first one is a diagnosis and treatment at the cancer center according to the international guidelines, establishing a multidisciplinary team and learning from experts from developed countries. And second one is implement a breast screening program and training specialists in rural areas. And third is the influence of education on the health, public health. And 2021, and we established breast cancer with the multidisciplinary team at the National Cancer Center of Mongolia. And currently our team has a radiology and breast surgery and breast reconstruction, pathology, medical oncology, radiation, rehabilitation, laboratory, cancer registry, psychology, nursing, and supportive and palliative care specialists, including our new multidisciplinary team. As that picture where we established first time in our country, National Cancer Center of Mongolia established breast center with the MDT team. And as a before pictures, and before the 2021 in Mongolia, the breast cancer surgery department related to the thoracic surgery department. It's been just 1 outpatient room there. A lot of women with the breast cancer, also lung and upper GI cancers. A lot of people that are mixing and waiting listed too much that room. And that time we decided to increase the over cancer outpatient clinic care. And I mentioned before, our cancer center is almost 63-year-old, and there is no space to establish another new outpatient clinic for women. And we create a small space. We found a small space in our cancer centers hall, and we built it ourselves all summer, all month. And there is to build ourselves as a new small outpatient clinic for patients. It's our interdisciplinary team. Currently, there's a small 2 outpatient clinic. We serve we have 2 outpatient clinic, rooms, and new OP1 is for new visitors and planning, and OP2 is for follow-up for survivors and workup tests. And we perform the clinical breast exam, ultrasound, and mammography, and 5-needle and core needle biopsy. So small rooms. And that time, and absolutely we need advice and consultant with from the developed countries, and successfully we contacted the University of Minnesota, University of Utah team breast centers, and at that time 2021 we started a international joint tumor board, and started 2021, and which is a Dr. Todd Doodle, who is a University of Minnesota Medical School professor, and Dr. Raymond Price, Dr. Christian Brownson, and their team started the tumor board. It's now has been continuing over the 2-year half. And last December, Dr. Kristen Brownson and our team published our tumor board result in the GSR journal. And 2021, Dr. Total from University of Minnesota and Dr. Price and from we organizing at a meeting, and the lectures also we scrubbed together and aftercare patients. And we do MOU with our national. We did our MOU with our National Cancer Center of Mongolia's administration. And after that great effective and meaningful tumor board at Mongolia, 2017, almost over the 90% of women received mastectomy cases, and just 1 year later, after we established the breast center, is a mastectomy cases almost decreased to almost 40%, and breast conserving and another surgery case numbers increased. And 2021 currently, and every year we performed around over around 500 surgeries with general surgery, local anesthesia surgery, biopsy procedures now, and our outpatient clinic visitors number is almost 15,000. And that's the effect of after establishing a breast center 2 years later, and our mastectomy cases decreased and breast cancer surgery case increasing. Also another kind of breast reconstruction surgery and autologous and implant reconstruction tissue expander surgery cases is increasing. And in the scope of a second project and the screening project and the training specialist in rural areas, we implemented the mobile clinic project. And our country, there's a mobile clinic project. We rent a small van, and the small one, and it's based on ultrasound screening program. And we went to 4 provinces and include 4 provinces, 62 districts. Women attended in our mobile clinic project that time. Yeah. And during that project, we presented some lectures, and it's in order to increase the public's breast cancer awareness and to teach the people's clinics breast exam and lectures. And also during the project, and some countries, some province, we teach the breast imaging approach, how to perform breast ultrasound, how to read the breast pictures, and also lectures and workshop, some core needle biopsy and a fine needle aspiration, the practice we did. And it's a result of the evolution of the results of ultrasound-based mobile clinic early detection. We also published in our country's cancer journal, and that's the result of the 2023 attended the mobile clinic project, and 11 malignant tumors were detected. It's the effect is really high. And in the scope, third scope, every month we start the breast awareness program, breast awareness lectures and public meeting at every October. We are organizing in our National Cancer Center of Mongolia, and in breast cancer survivors, their family, and other volunteer peoples attend our breast awareness program in our country. And eventually, we are trying to develop that proposal first on an established and a multidisciplinary national multidisciplinary team breast center at NCCM with the sentinel node approach, MRI, tomosynthesis, stereotactic, and genetic oncotype, and after the pathology department. It's me and the National Cancer Center in Mongolia, and trying to follow with the guidelines standards. And the second is thing is increasing the early detection and centralized care by implementing mobile breast cancer screening clinic and establish the breast outpatient clinic. For underserved rural areas. In the scope of this project, eventually we intend to establish breast cancer is found in 6 to 8 provincial regions in screening equipments that lack of breast specialists can access them. We can receive the suspicious cases and image provide a further treatment much quicker. If we successfully reform this system and link it to the national health insurance coverage, it will provide an opportunity for this project the further success in the sustainable manner. So a small proposal we are developing. And as I mentioned before, and mammography breast cancer screening is not so popular in our country. It is still in our country, just few mammography machines in capital city and the countryside and small districts, towns. That, we don't have mammography machines. And due to that situation, we are trying to firstly develop the ultrasound-based screening program in the whole country with the mobile clinic and local doctors teaching program. And it's meaning that by the ultrasound, if the patient under the virus 3 benign suspicious lesion, they can follow the countryside local region, and over the virus 4, maybe I recommend a mama with the nearest province or National Cancer Center of Mongolia. And ultrasound and mammography both approach a patient if has a high risk and diagnose and treat by guideline, and the low risk discuss with the MDT team and short-term follow-up. That kind of flow chart also we are developing. And this also over the 2 years and cooperation with the University of Minnesota, Utah, and this month I've been rounding at the University of Minnesota department
Great. That was a fantastic echo again. So sorry, guys. That was a fantastic presentation by Dr. Pushkin. At this point, I want to open it up to everyone on the call. Does anyone have any questions or comments for Dr. Pushkin?